Hi.
Hi, I'm Jackie. I'm a nurse practitioner, and I'm going to be assessing you from head to toe today. Is that okay with you?
Yep.
Okay. Can you tell me your first name and last name and date of birth?
Sure. Diana Staryeva, 4/18/92.
Okay. How are you feeling today?
I'm good, thank you.
Any pain anywhere? Any
No.
complaints? No.
No.
Okay. What did you have for breakfast today?
Cereal with milk.
Good. Okay. Well, you know where you are?
Yep. I'm at the LIU clinic.
Okay. And do you know what day it is today?
Yeah, it's December 2024.
Okay. And do you know what year? Oh, 2024. Do you know who the president is?
Yes, Donald Trump.
Donald Trump. Okay. And I'm going to give you three letters, words, and you're going to see if you remember them at the end, okay?
Okay.
So I'm going to give you red globes fly,
Okay. Red globes fly.
okay? All right, it's an easy one. Anyhow, so I am going to start out by just looking at you, right, from your skin. I'm going to, mind if I touch you? I'm going to touch skin tugger is perfect. There's no dryness, there's no moisture, there's no lesions, there's no scratches, no scars. So your skin looks great. And can I look at me straight, please? And I'm looking at your face, and your skin also on your face is beautiful. You look well nourished. You look learn oriented, times 4. You're giving me a good eye connection. So thank you. So I'm looking at your skin and your head, and your head is no cephalic, it's a symmetric, and I'm going to go in there and to check to see any lesions, infestations, or anything that could be either that should not be in there, okay? So right now I'm going to inspect it. There's no signs of alopecia. There's no missing hair at all. Everything in your hair is equal distributed. Your hair is nice and soft and well distributed. I don't see any indentations. I don't see any lumps. I don't see any scars. And I said, okay, it looks nice and symmetric. Okay. And now I'm also going to palpate your temporal arteries. Okay, +2, nice and rounding. Okay. Oh, did I say before that I washed my hands and I did hygiene before I started this?
But you did do it because I saw you do it.
Thank you. I just wanted to make sure.
Yeah.
Okay. So, we did the head, we did the skin, and now I am going to look at your eyes. Your eyebrows are symmetrical, your eyelashes are symmetrical, there's hair, there's no bulging of your eyes, there's no drooping on one side of the face, there's no epithalamus, meaning the eyes are not bulging, there's equal skin, your eyes, the ears, the nose is in the center, your mouth is in everything beautifully symmetrical, okay? So now I'm going to ask you if okay, so I'm going to ask you if you could see this pen, okay? I'm going to shut the light right now, and I want you to look further away, and then I want you to follow this pen, and I want to see when it gets closer for accommodation. So I see the pupils constricting, and I see them reacting. So dilating and constricting, so the accommodations are perfect. I'm going to look at your eyes. I see inside the sclera is white. There's no yellowish. There's no signs of jaundice. There's no lacrimal dryness or any discharge. Your external and internal canthus is dry and intact and pink and moist. I'm going also to look above. Okay, nice and moist. The bottom, nice and moist. Okay, and your pupils are equal, round, and they're even. Okay. So now I'm going to ask you to, I'm going to test your oculomotor, your eyes, your 3, 4, and 6, excuse me, your 3, 4, and 6, yes, your fingernails, okay? So first I'm going to ask you to please follow this pen. It says cardinal gaze fields here, so follow me. Okay, so yeah, just don't move your head. That's perfect. And then now I'm going to come around. I'm going to check your pupils for direct constriction, right and left, even. And then I'm going to do indirect and then direct eye. They're both constricting and they're both working, okay? Now I'm gonna ask you to please close one eye and tell me how many fingers you see.
2.
And then the other eye. And then the other eye, cover the other eye.
I'm not sleeping with it. 2.
Okay, so I see peripheral vision at this moment, okay? So your extraocular movements are intact. So now I'm gonna do this nice chart, okay? This is optic nerve, this is 2, okay? Your cranial nerve. So I'm gonna stand 20 feet. I'm gonna ask you to cover one eye again, and I'm gonna ask you to read the first letter you see.
DHJBS.
Okay, and now do the other eye,
DHJBS.
and then straight ahead.
DHJBS.
And you don't wear any corrective lenses, right?
No.
Good, perfect. Your vision is 20/20. Now I'm going to check inside. Okay, I'm gonna shut the lights down again. I'm gonna look inside. Okay, I'm gonna look with my right eye with your right eye. So I'm gonna look inside. I see red reflex, macular. There's no edema, macular edema. There's pupillar constriction. There's no, the sclera is white. There's no opacities, no AV nicking. Okay, it looks nice in it. And I'm gonna do the same thing to the other eye, okay? And they're both normal, okay? So, okay, you have your cusp was also 1 to 2 ratio, and no macular degeneration or edema, so your eyes look really good, okay? What else? Okay, I'm gonna ask you also now to cover one nose. Breathe. Okay, good. Breathe. Okay, so this is your olfactory. So I'm gonna ask you now if you could smell. Now cover one nose again. They're both painting. So now I'm gonna ask you for the smell. What is smell?
Alcohol.
Okay. And what is this smell here?
Coffee.
Coffee, great, okay. So now I'm going to go inside and I'm going to inspect. Okay, I'm gonna go inside there. Fresh, I'm gonna go in your nose. So I see your nose is a pain. I saw that earlier by you sniffing one side to the other, you were smelling. So I'm gonna look up, I'm gonna pull back. I'm gonna go inside. I see nice and clear, no deviation, no discharge, no erythema, no exudate, and no polyps. Nice. You can see nice and clear. And then the other side, also clear, no polyps, no exudate, and no deviation, and no discharge, and no erythema. Okay, so that looks good. Okay, so we did your nose, right? So now I'm going to palpate your nose here, your maxillary. Any pain?
No.
And up here?
No.
Okay. And what about your mastoid?
No.
Excuse me, the mastoid, and then your tragus. Any tenderness? No. Okay, so I did all that. Now I'm going to look at your ears. Okay, so I'm going to do the whisper test. Okay, so cover one ear. Sorry.
1, 2, 3.
Cover the other ear.
1, 2, 3.
Okay, so cranial number 8 is intact. So now I'm going to also inspect your ears. They're nice. This is the eye. So I didn't look at the ears yet because I just saw the nose. So I'm going to look at the ears. They're both auricles. They're both even, intact. There's no tophi. There's no scars. There's no discharge. So I'm going to pull the auricle up and back. I'm going to look in. Right side is 4 o'clock, the cone of light. There's no erythema. There's no ceramin. There's no discharge. I see flaccid palus and malleus is also visible. And then I'm going to go on the other side, and it's also going to be visible, but the conal line is 7, okay? And there's no discharge of the edema. So whatever I did to the one side, I did to the other side. Okay, so we did the ears, right? I'm sorry.
It's okay.
Now I am going to do your Rhine test. Okay, so I'm gonna hit this. I'm gonna put it on your head, and let me know if you hear bilaterally or one side or the other more. Okay, so here we go. You hear it?
Yep, both sides.
Okay. And what about now?
Yes, I hear it. Stops. Stops.
Great. So air conduction is greater than bone conduction. So this is great. So that's cranial number 8. Okay. So we did the ears now. Now I'm going to do your lymph nodes. So I'm going to go in your occipital. I'm going to go into your preocular, the postocular, the thyroid, the submandibular, your submental, your anterior cervical, your deep cervical, and behind the sternocleidomastoid, and then your posterior cervical. Any tenderness anywhere when I touched you?
No.
Okay, I also got your supraclavicular here. Any tenderness on there?
Mm-hmm.
No, perfect. Okay. So now I'm going to look at your mouth, inside your mouth, right? Okay. So I'm gonna go inside your mouth, and I'm gonna see your lips are even, nice, no moist, no cracks, no sores. I'm gonna ask you to open your mouth. I have the tongue depressor and I have my light. I'm gonna go in. I'm gonna look around. Dentition is complete. Upper, softer, soft palate, hard palate intact. There's no sores. There's no hair on the tongue. There's no eczema. There's no swelling. Up your tongue. Frenum is intact and it's nice and clear. Buccal, right and left side are perfectly moist and pink. Okay. So that's cranial nerve 10. Say ah. Okay, so that's, so let me see that again. Okay, so yep, so it's cranial number 10, the gag, and cranial nerve 9. Okay, so now I am going to inspect your thyroid, and everything's intact in the middle. There's no goiter. It's midline, okay, and yeah, so this is nice. Okay, so I'm gonna ask you to turn around, and I'm gonna ask you to swallow a glass of water, and I'm gonna feel to make sure it's elevated. Okay, swallow. Okay, so it's nice and elevated. Perfect. So while I'm here, I'm just gonna check out your spine. I see you sit up straight, so let's make sure there's no scoliosis, there's no kyphosis, any tenderness?
No.
Any tenderness in the parasternum?
No.
No sternum. Okay, so now I'm going to look at you, turn around and look at your chest. I see that your chest expansion is equal. There's no accessory muscles being used. There's no excavatum, there's no pigeon chest, no barrel chest. Diameter is 1 to 2. Everything is symmetrical when you're breathing. I'm going to percuss now to listen to tympanic. Okay, sounds good. Okay. Right, so now we got that. Now I'm going to listen to, I want you to breathe for 1 minute. Okay. All lung feels. So I'm going to take a deep breath through your nose, out your mouth. Okay, bilaterally. Easy breath. I'm falling asleep on me. All right, now let's go to the back. Your lungs, they sound perfect. But you know what? While I'm here, let me listen to your full maximum points, okay? So your apical pulse is here. Aortic pulse in your second intercostal space on your right side. Clavicular, and then you have your aortic, pulmonic. I hear it, and then you have your tricuspid, and then you have your mitral, which is your point maximum point. Okay. And listen for a full minute, and then at the same time, I'm going to take your pulse for a whole minute, and it's equal. There's no pulse deficits at the moment. Okay, perfect. And your respiration is 16, okay? And I did your temperature earlier, so it was 99. I did your O2 saturation, it was 99. So I have all your vitals together, your respiration. Now I'm going to palpate any tenderness. So this is your, also your aortic, your pulmonic, your tricuspid, and your mid-clavicular line of your mitral valve, which is your maximum, okay? So there was, everything was clear. I want to also take this back, because I want to see, I don't see any heaves, any roots, anything, any pulsations on the side, and also on that side here. And there's no JED on the right side. I'm going to listen with the bell. Okay, no roots, no hips, everything sounds even. I'm going to take your blood pressure. Good, relax your arm. I'm going to put this in the brachial. Goes in your brachial, inflate it. (120 over 78). You have a great pulse, okay? Let's see what's next. Okay, now I'm going to test the vascular. I'm going to notice that you have no cyanosis on your lips or anything color, discoloration. I'm looking at your fingers. There's no clubbing, there's no cyanosis. Okay, capillary reflux +3 in each finger, right and left hand. Okay, so there goes your then I'm going to feel your radial, which is here. Pulses are even on both hands, nice and bounding, and then your brachial. Perfect, and then I'm going to check your femoral here, right here, perfect. Okay, and then your popliteal, posterior here. Okay, bilaterally there, you could +2 so far, 2. And then your dorsipedialis, epedius, and then your dorsal. Okay, +2. And now I'm going to listen again. I'm going to listen to with the bell and the diaphragm. Okay, listen. Okay, I'm going to listen to your right inguinal-femoral artery here. And then your left. Okay, and I'm also going to do the same thing on this arm. Listen and listen. Okay, listen here. I'm going to listen here. Listen to dorsipedialis. And everything is equal and +2, and there's no signs of root, no absent pulses, and everything is audible. So you are good to go right now. Okay, so now I'm going to check out your abdomen, okay? So I'm going to lay you down. Are you warm enough? I'm good. Okay. Okay, so I noticed that your stomach is not protruding. It's equal, it's not distended. I don't see any mass, I don't see anything that's out of the ordinary. Beautiful skin color. So I am going to ask you to put your feet down a little bit. Okay, I inspected all 4 quadrants and there's nothing abnormal. Now I'm going to auscultate. So I'm going to listen to all 4 quadrants for a minute, starting from the right lower quadrant, upper left, and lower left, and there's 30 to normal vowel sounds, which is 30 to 50. Okay, and then I'm going to go here and I'm going to percuss all areas. I'm going to start from the bottom with the right lower quadrant. Okay, it's all tympanic. Now I'm going to percuss the liver on the right side. Okay, so it's 4 tympani, and it's the borders are there, and then the spleen, borders are 67, and then the spleen, it's not protruding, so we're not supposed to palpate it, so it's not palpable. Okay, so we did all that. Now I'm going to do a light palpation here. Okay, now also a deep palpation. Okay, I'm going to ask you to sit up so I can check your kidneys. I palpated the liver and the spleen. The spleen is unpalpable and the borders are 6 to 7 on your liver. So now I'm going to check your kidneys. How does that feel? Fine. How does that feel? Fine. Okay, good. So we did that. So I palpated all you. Any tenderness in the back of the nose? You didn't feel any tenderness, but I palpated your quadrants, your stomach. Okay, so let's do some musculoskeletal assessment now. Okay. Okay. Right now. Okay. Okay. Yes. So right now I want you to walk straight, heel to toe, heel to toe, heel to toe. Okay. This is sports. No privacy, sorry.
No privacy. There's a janitor walking by.
Head to toe, head to toe. Okay. And I'm noticing that she's straight, the gait, her shoulders are even, so there's no scoliosis, there's no kyphosis, and she's got nice gait, balanced. And now you're gonna walk like this in your heels.
Okay, I'm gonna copy you.
Okay, copy me, and then I'm gonna walk on your tippy toes.
Okay.
Great, no pain, any pain,
No.
nothing? Okay, perfect. Now I'm gonna ask you to touch your feet. Okay, great, and now turn around, and I'm gonna ask you to go back a little bit. Okay, you feel nauseous, dizzy, nothing?
No.
Okay, perfect. Okay, now I'm gonna ask you, follow me.
Oh, okay.
Side to side. Okay. And then, perfect, and then neck to neck, side to side, and then up, down, and now resistance. Okay, no resistance. So I'm gonna ask you to go like this and fight me.
Okay.
How do you feel?
Good.
Strong muscles, 5 to 5.
Good.
Okay, now we're pronate and supinate.
Okay.
Okay, how's that feel? Okay.
Fine.
Alrighty. Think about everything. Trying to think. Okay. I don't want to miss anything, so.
Of course.
Okay. So I want you to follow my.
Okay.
Follow me. I mean, like touch your nose and follow my finger.
Okay.
Perfect. You're faster than I am. Great. Thank you. Now the Roomba. So, fight me. Okay, ready?
I'm not swaying, right?
Nope. I'm letting you go. Perfect. You're not sore. You don't feel any dizziness.
No.
Okay, great. I'm gonna palpate. Is it okay if you stand up?
Yeah, I'm fine.
Okay. I'm gonna palpate all your muscles, your biceps, your triceps, your forearms, the shoulders. I think you like this. And then
I think I deserve some massage.
so with this, follow me. Meditation.
I like to follow you without any words.
Follow me.
Okay.
Okay, now you're going to put your elbows. Okay, I'm gonna just go like this a little bit, rotate, extend. Any pain?
No.
Any clicking? No clicking? No,
No.
nothing heard. We already did the supine.
Yeah,
Okay,
we
we did
did.
that. And then now let me just feel anything here. Okay, go like this. Okay, nice range of motion. Now go like this. I'll separate your fingertips. Good, perfect. And then you have no Herbert, PIP, DIP, no Butcher's nodes, no sign of osteoarthritis at all in a young girl like you. Okay. Okay, let's lay down so I can check your hips. Okay, you comfortable?
But now I'm comfortable.
Okay, so I'm gonna ask, then we'll go like this. Is that okay? Does that hurt? No, I'm gonna go this way. Is that okay?
Yep.
Is that okay? Okay, now I'm going to abduct and abduct. And I'm gonna do the same thing. Here, external, internal, abduct and abduct. Is that any pain like that? Any feel any pain in your
No.
hips? Okay, so we took care of your hips, and now I'm gonna check your ankles. Any pain? Any tenderness?
No.
Okay, I want you to up, yep, and I go down. Perfect. Any pain? Nothing. Okay, I'm gonna check your capillary refill on your each of your toes. Nice and moist and pink. Those 3, the blood returns. And I did the right and I did the left side. Now I'm gonna do the Babinski. Is that verticals? Good? Okay, good. Now I'm gonna have you do the resistance of the leg, okay? I want you to lift your leg up and fight me. Is that okay? We're strong, 5 to 5. Let's put your leg. 5 to 5. Okay, so we have the MSK. Now we're gonna do the sensory, okay? I'm gonna set you up. This is the fun part. Straight up, okay? So I'm going to ask you to go like this, your legs, your chin, and down.
Oh, the heel to
Heel
shin?
to shin, yeah.
yeah.
How's that?
Yeah,
Feel
good.
good, right? All right, so now I am going to give you a few things to feel. So I'm going to give you sharp and dull. Okay, you're gonna tell me. You're gonna close your eyes and you're gonna tell me when it's sharp or dull. Okay, tell me what you feel now.
Sharp. Dull, I'm sorry. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. 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 Sharp. Sharp. Dull. Dull.
Okay, and now we're gonna do the vibration. So I'm gonna hit something, and I want you to close your eyes still, and I want you to tell me. It's called stereography. I can't say the word, but stereogonal. So I'm going to hit this, and I'm going to ask you to tell me what you feel, and close your eyes.
Okay, I feel it on my arm, on my shoulder. Okay, on my arm, on my shoulder. My
Okay.
knees, on my knees.
Nice vibration, huh?
Yeah, on my upper thigh, left.
Okay, so now I am going to give you something for your hands, and you're going to tell me what it is. Okay? Close your eyes, give me your hands. What did I give you?
A pen.
Good, so that is going to be perfect. So now your reflexes, okay? Like when we were kids, we used to play with this a lot, remember? So I'm going to hit you here, and then okay, and
Okay.
then biceps, and then triceps, and then break it.
Okay. Okay.
And then I do the other arm as well, okay? Now I'm going to do the patellar.
Okay.
Patellar is my fun part. And then the back. Okay. And okay, I think we got all your reflexes there. All right, so let me just tell you, I think we did good. We're going to review all your cranial nerves. As I went on, I was reviewing them. So cranial nerve 1 is you have one nose, so it's your olfactory, which tells you which sense of smell, which you said it was coffee, and alcohol, so you did good. Oh, cookie, what did I give you? I forgot. And then cranial number 2, you got 2 eyes, so it's going to be optic. And then 3, 4, and 6 is going to be all your extraocular motor. And then, oh, I didn't ask you to put, did I ask you to puff up your cheeks to 7?
I don't
We
remember.
could do it again, 7. And then smile, and then eyes. All right, this is okay, so that's cranial number 7. 8 was the whisper test. 9 was the gag reflex that I gave you. And then 10, yeah, so you opened that one up, and then you gagged, and then the 11 was the shoulder spinal accessory, which is the shoulders. Okay, and then 12 was the hypoglossal, the back, the tongue, and then salty, I gave you something for the sensory part, something salty or sweet. And I think that was a part of terminate of our examination. Oof, we got through it. So
Thank you.
I hope to see you again, and you're wonderful. Stay healthy, and we'll talk to you soon.
Thank you.
Thank you.